Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, October the 21st, 2020. Today we are joined by Toronto's Medical Officer of Health, Dr. Eileen De Villa, and Toronto Mayor John Tory. Mr. Mayor?
Well, good afternoon and thank you, Brad. Today, Dr. De Villa and myself will be speaking about the importance of people getting the flu shot. And I join her in encouraging all Toronto residents to get the flu vaccine this year. The Ontario Ministry of Health procures and distributes the flu vaccine. The vast majority of people get their flu shots from their doctor or at pharmacies, and I want to thank all the people behind the annual effort for working to provide this important service. They do a great service to us all. Public Health also runs 4 flu vaccine community clinics, along with administering the vaccine at places like shelters, drop-in centers, and interim lodging sites. This year, Toronto Public Health flu vaccine clinics are more important than ever in the wake of COVID-19. And I want to thank Toronto Public Health and Dr. De Villa and her whole team for the work that has been done to ensure that these clinics can operate safely and that the ongoing work of confronting the spread of COVID-19 in our community can continue at the same time. The province's flu vaccine campaign is an example of how our governments can work together with our important community partners to help our residents and to keep them healthy. Throughout the pandemic, I've been focused on making sure that our city government works productively with the provincial and federal governments to help residents and businesses get through these incredibly tough times. That cooperation has ensured that we've been able to save lives and try to mitigate the economic impact of these unprecedented but necessary public health measures. I'm thankful that the Government of Canada in particular moved quickly in response to our advocacy and the advocacy of others to help restaurants and other businesses impacted by the closure of indoor dining, accompanied by some provincial measures of help as well. I'm continuing to advocate on behalf of the industry for needed tweaks to the federal program to ensure that places which are effectively closed, if not officially closed, and that's restaurants and hospitality establishments, are treated as closed in order to qualify for help, including the extra help that is available to those who are closed because of a public health order. For example, there have been instances in which a restaurant with a patio for, say, 10 people is considered open because it has a patio and thus ineligible for this extra assistance, when in fact, as the weather has changed, that same restaurant is in reality closed on a cold, rainy day because the indoor dining portion of that establishment is also closed. And I think that the governments should reconsider those kinds of definitions to expand those who are effectively closed and make sure they can get the necessary assistance. And while the assistance that was announced by the federal government was retroactive to the end of September, I have requested, again, following consultation with the industry, we've had extensive meetings with them over the last number of days, that the availability of assistance be taken back perhaps a bit further to take account of the rent and other costs, other fixed costs that have been mounting as the weeks and months have gone by, especially the lengthy periods of closure earlier on and now the 28-day period that we're in the middle of. I also think it is past time for governments with the authority to do so to take steps to deal with unreasonable measures taken by insurance companies and food delivery companies during a health emergency. I understand they're in business, but we're in a health emergency here, and I think special measures are called for in special times. I fully support any action to be undertaken by the province to help address this, to support businesses who are simply trying to stay afloat, to be good citizens, and to be continuing customers of these very same insurance companies and food delivery companies. And I hope that the government can put some kind of a pause in place to take account of a health emergency, which has also become, for these companies, these restaurants and these hospitality establishments, it's also become a business emergency for them, and it affects the jobs and the well-being of an awful lot of people. I also continue to support the province continuing the ban on commercial evictions to protect these businesses and our main streets. Again, my position as a matter of common sense throughout has been the fact that if landlords, commercial landlords, evict commercial tenants like restaurants and small businesses, they will be the ones that will be worse off in the end because they will have no tenant left to pay any rent, and there's not likely to be a lineup to rent out some of these premises after the COVID pandemic has come to an end. The province has also taken action with our full support to allow restaurants to continue to sell alcohol for delivery and takeout beyond the end of this year. I strongly support their decision to make that feature, to extend the life of that feature, which has been very popular with the businesses and also with consumers. But we're also requesting the province, on the advice again of the hard-hit hospitality industry, to review alcohol pricing for restaurants and bars with a view to recognizing, even for a period of time, the dire straits that these businesses are in. As we understand it from the industry, these establishments, bars and restaurants, usually pay a premium price for the acquisition of their alcoholic beverages over the retail price that would be paid by you and I. Again, relief on that front is much needed, and it would be welcomed simply because it will help to take one more element of financial pressure off of these businesses that are struggling. So we are calling for change on behalf of the restaurants and bars who are working to keep their doors open through these very tough times and who are working with us, and they are doing the right thing in the context of the public health orders that affected them so directly. They're doing it to help us get through the pandemic and to stop the spread of COVID-19. We're doing what we can at the city to help. Today, the Executive Committee voted unanimously to move forward with the recommendations that I put before them to help restaurants and businesses during the winter months of the COVID-19 pandemic. The recommendations approved today will ensure that the city allows, to the maximum extent possible, subject to regulations that are in place, for winter patios on sidewalks and other spaces. This set of recommendations approved by the Executive Committee today will go to the City Council for approval next week, along with recommendations approved by the Planning Committee yesterday with my full support to make the needed zoning changes to support winter patios. Again, this is the right thing to do. And frankly, I'm excited by the idea of the city encouraging winter patios, and I look forward to seeing those businesses who are able to embrace this idea being in a position to do so. I should point out that there will be continuing regulations that affect these patios from the standpoint of health and safety, so they don't turn into what amounts to indoor spaces of a different kind with poor ventilation, for example, and there will be some safety factors involved. But I think what we've now done is taken away the red tape and taken away some of the fees in order to make it as easy as possible for people to explore this option. We're taking action to give businesses the flexibility to operate where safe and where possible outside during the winter months. While we have some limitations with respect to patios in curb lanes for obvious reasons, so that we can safely and effectively clear the snow, which will start to fall at some point this year as it does every year, there are opportunities that allow us to extend the patio season and the success we've seen for these hard-hit restaurants through the winter in areas such as sidewalks and private property, including, in some cases, for example, parking lots. I also welcome the fact that the recommendations approved today, including directing our Economic Development and Culture Department to work with Destination Toronto, our tourism development agency, and all of the business improvement areas, including Tabia and businesses in non-BIA areas, to support safe winter economy initiatives and promote the winter economy, including programs that are called BYOB. Many will think that means bring your own bottle, but in this case, it means bring your own blanket campaigns, which are campaigns that will help us to promote winter patios and thus help the struggling restaurants and other institutions like that. This is another good step forward. We're going to be having quite a few promotional activities when the time is right to encourage people, as I do today, to support their local restaurants. I would say for the moment, support through takeout. Do not support, if you can get takeout, the delivery companies, because most of them are taking advantage of the situation that I consider to be a health emergency, and I think are not deserving of that support until they take measures in turn to help the restaurants that support them and help make things better. But we are trying to do everything we can to help people and to be as nimble as possible to deal with the ever-challenging nature of this pandemic. And on that note, I will ask Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I am reporting 346 new COVID-19 cases. This new count brings our total since the pandemic started to 25,278. Today, 128 people in Toronto are in hospital with COVID-19, 21 more than yesterday. A big part of outsmarting COVID-19 will be by getting a flu shot this year. And there's 3 ways to do this: through your doctor, at a pharmacy, or at one of our Toronto Public Health clinics. Our Toronto Public Health flu clinics are appointment only and must be booked online or over the phone. I encourage you to choose the option that works best for you. Toronto Public Health is actually one of the smallest players in the delivery of the flu vaccine. It's been almost 10 years since the flu vaccine became available in pharmacies. That access to flu shots started in Toronto in 2012-2013. Since then, programs have expanded through workplaces, and naturally, many people get their flu shot during a visit to their own doctor. At Toronto Public Health, we've been prioritizing clinics primarily for people in Toronto who face barriers to access. For example, between now and the end of December, we will be providing 60 flu vaccination clinics in shelters all around the city. Last year at Toronto Public Health, we administered a total of 7,621 flu doses. A far greater volume is delivered through doctors' offices, pharmacies, and other kinds of flu shot programs. Each year, about 30% of the population gets a flu shot. This year, COVID-19 has increased awareness of its importance. So this year we are expecting a higher demand, and we've extended our clinics through to the end of December. Information on our 2020 flu vaccine clinics is available online and should be displayed on your screen now. Steps will be taken and COVID-19 protocols will be in place to keep these clinics safe for clients and our staff. The number of clients will be limited to allow for physical distancing. Everyone is required to wear a mask indoors with some exceptions, and Toronto Public Health staff will be wearing appropriate personal protective equipment. Above all, if you feel unwell on the day of your appointment, don't come. The clinics do run through to the end of December, and there will be time to rebook. A flu vaccination is free for anyone 6 months of age or older who lives, works, or goes to school in Ontario. A health card is not required at a Toronto Public Health flu clinic. Last year in Toronto, a total of 2,771 lab-confirmed influenza cases were reported to Toronto Public Health. This was higher than the previous 5 seasons and probably an underrepresentation of the actual number of cases, because not everyone who actually gets the flu gets tested as well. My understanding from the province is that they have confidence in the supply of flu vaccine, but demand this year means getting your flu shot may require a little extra planning and a little extra patience. I do encourage you to get a flu shot at a convenient pharmacy, through your doctor, or by booking online at a Toronto Public Health flu vaccine clinic. Finally, today, I want to return to numbers. Our percent positivity figure for Toronto, or the percentage of positive COVID-19 cases per 100 individuals tested in a given week, is up. Today, our percent positivity figure for Toronto is 4.4%. It has increased 1.3% since I spoke with you on Monday, when it was 3.1%. The figure could yet change because we find data for the most recent week can be incomplete. But I feel comfortable saying I have no basis to expect it will fall 1.3%, and that I'm concerned that its upward climb is not over. especially when I look at COVID-19's renewed eruption in other countries. In the United States, daily cases reached 70,000 last week for the first time since July. That's 490,000 cases per week. A public health expert in Utah says that the state's healthcare system is at a breaking point. Today, Ireland began a national lockdown for 6 weeks. Non-essential businesses are being closed, and the Irish people told to go no more than 5 kilometers from their homes, except for work and other essential reasons. It's estimated that 150,000 people in Ireland will lose their jobs in a matter of days. The total number of cases in Ireland has risen by 75% since the beginning of September. Similar restrictions are being imposed for 2 weeks in Wales. Regional lockdowns are being imposed on parts of Spain and Italy. On Saturday, France will impose a nighttime curfew for 4 weeks on Paris and 9 other cities. In London, on Saturday, indoor socializing will be prohibited between people who don't live together. All of this worries me. It worries me a lot. There is nothing to prevent COVID-19 from catching fire here except the choices we make. We are protected when we act in ways to keep apart as much as possible from people we don't live with. When we keep 6 feet distance from people we don't live with. When we wear masks and when we regularly wash our hands. When we do whatever it takes to make it harder for the virus to spread, because the virus needs us to keep on spreading. It cannot do anything without using us to do it. It had the capacity to want. COVID-19 would want us exactly where we are right now. Tired, frustrated, impatient, and worn out with living like this. I know I'm out here urging you forward, asking for your patience, trying to strengthen your resolve. Actually, I'm just like you. I'm as tired of living like this as everyone else. But it's my job not to be. So I'm not giving up on getting this right, and I'm not giving up on you. We've all seen how generous Canadians can be. When disaster strikes, we're right there, stepping up. This disaster is different because it seems endless, and we're all trying to survive it. We're not going to let this get out of control, not if I can help it. But I need everyone. I need everyone to pitch in, especially on the days when you don't want to. With that, I'll now turn it back over to Brad.
Thank you, Dr. Davila. There are a number of staff on the line today to answer any specific questions you may have, including Chief Pegg. First up is Lauren Pelly from CBC News. Lauren, go ahead, please.
Thank you. I'm still just digesting that hospitalization number there. That's quite a spike. My question for you, Dr. Davila, is looking at the potential COVID-19 vaccine that hopefully we'll see one day in the months ahead. Can you talk a bit about, after a vaccine is hopefully approved, what role would Toronto play with that? How would you work with the province in terms of actually getting that to the public and prioritizing who would actually get that first as you need to scale up production of a successful vaccine?
So that's a great question, and a series of questions actually in one, but let me try to wrap it up fairly succinctly. There is clearly an interest in COVID-19 vaccines, and procurement of vaccines is actually the responsibility, I should say, of the federal government. We know that they have made purchase orders in respect of 6 different vaccines, that these vaccines, 5 out of 6 of them, last I checked, were in advanced stages of clinical testing, and we're very, very hopeful to have vaccine at some point in the future, not too distant future, hopefully. And what happens is that the federal government works with provincial governments around how to distribute vaccine, and there are certainly many, many conversations. We've been working over the past several weeks ourselves at Toronto Public Health in concert with provincial partners on planning activities around COVID-19 vaccine and how that vaccine might be administered. But just to give you a little bit of a flavor, we know, you might recall, back in 2009 when we were in the H1N1 influenza pandemic, mass immunization clinics were held throughout the city and in fact throughout the province. So these are the kinds of things that we have some experience in planning. We will certainly be doing that kind of work ourselves in partnership with community and community agencies, with other healthcare partners, with provincial partners. Lots of work underway, and as we move this forward, you'll be hearing more and more by way of detail from us as we work out those details.
Thank you. One more question on behalf of one of my colleagues. Looking to the winter months, this is something for Marianne Bedard. Can you talk a bit about the plan for encampments and, what we can expect to see, given that's been such an issue in the city over the summer?
Go ahead, Marianne, please.
Thank you, Brad, and thank you for that question. So Streets to Homes will continue to do the work that they do every day, which is visiting encampments, and making connections with people, talking to them about what their housing needs are, talking to them about what their situation is, and making that really important human connection. As people are willing, we will be moving people inside into indoor placements. We unveiled our winter plan last week, which includes both low barrier respites, hotels, shelter beds, and supportive housing. So we'll be working with people who are outside to try to encourage people to come inside, and we will continue to provide support to people who are outside. Our Streets to Homes team delivers water, they deliver blankets and sleeping bags in extreme cold weather. And we will also be helping to transport people who do stay outside to our warming centers when we do inevitably, as the mayor said, hit the cold weather.
Okay, thank you. We go next to Haley Cooper from News Talk 1010. Haley, go ahead, please.
Thank you very much. My questions are for Dr. Davila. We wanted to ask you about these outdoor dining bubbles that some restaurants have already purchased for their patios. They're very expensive, especially for restaurants already barely hanging on. And I spoke with one restaurant operator yesterday who expressed hesitation buying these bubbles because a solid directive hasn't come from you. So the way he sees it, they kind of defeat the purpose and bring indoor dining outdoors. So do you support the restaurant owners feel confident in putting out the money in buying these dining bubbles, only to, like, they don't want to hear in a week's time, 2 weeks' time, that actually public health doesn't support these bubbles?
So, I have to admit, I haven't really had much opportunity. I'm just hearing of these dining bubbles myself for the first time. That being said, when we think about the restrictions that are currently in place regarding food and drink establishments, just a very quick reminder that these are provincial regulations. So it is under the Reopening Ontario Act, and they're regulations under that specific piece of legislation. So that question may be better directed towards my provincial counterparts and those who are actually involved in the details of those regulations and the enforcement around those regulations. This being said, I mean, really what we're trying to do, I think you've heard about a number of efforts that have been happening. The mayor commented on a number of efforts on what is being done. Really concerted actions towards trying to support businesses in our community, and especially those in the hospitality sector. I have mentioned many times a very, very delicate balance to strike, and a difficult one, trying to limit those occasions and those circumstances that give rise to COVID-19 transmission, that give COVID-19 that chance to spread from person to person. We are absolutely trying to avoid those circumstances so we can avoid what we're seeing on the other side of the Atlantic. Much stricter lockdowns, more significant lockdowns, and much stricter public health measures.
Thank you. And my follow-up, you mentioned a few times today how concerned you are, and you certainly sound very dire. So are you preparing us for the idea of being in the modified stage 2 for the entire winter, or is something more coming? Are there going to be more restrictions?
So I think what I'm trying to do is to explain that actually the choice is in front of all of us now. And it's up to us. We know what are the circumstances, what are the kinds of behaviors that actually give rise to COVID-19 transmission. So the power rests with each and every one of us. The more we are able to practice good self-protection measures by watching our distance, right, wearing our masks, washing our hands, limiting our contact to the greatest extent possible to those with whom we live. This is what we can do together as a community to prevent us from going into those more dire circumstances that we're seeing in other parts of the world. I think what I'm trying to say is that, look, these situations do happen. We've seen them in Australia. We're seeing them now in Europe. And we're seeing some pretty dire circumstances in the United States, not very far away from us. So I'm encouraging people to the greatest extent possible. Let's do this together. Let's take the situation into our own hands and do all we can to prevent COVID-19 from transmitting.
Okay, thank you. We go next to Sabrina Jonas from the CBC. Sabrina, go ahead, please.
Thank you. Good afternoon. My first question is for Dr. Davila. Doctor, the number of COVID tests is far below the province's target. Do you have concerns that the shift to the appointment-based model has created a barrier for people getting tests that might be leading those with symptoms not to bother to get one? And if the case, resulting in more untested people who may in fact have the virus and are unknowingly spreading it in the community?
Well, I think that we must always examine the different results and outcomes that result from different decisions. I think that when I think about what the province decided in respect of testing, there were reasons for which they made those decisions, and there was some good thinking behind that. And my hope is that the objectives that were being sought were achieved by making that decision. The issue now is, how do you manage the unintended consequences of any decision, if there are in fact unintended consequences? So first and foremost, monitor to see what's happening, determine what the situation is, and then make appropriate plans and take the action in order to address those circumstances. I think that's a very rational and reasoned approach to a changing and constantly evolving set of circumstances. So certainly we're observing and watching, and we're partnering with others within the healthcare system in particular, because they are the ones that actually provide testing to people all around the city. When we see that there are issues around testing rates, and you'll know that we've been posting, or we are now posting testing rates in different neighborhoods in the city for people to view, we're working with our partners to make sure that access and uptake to testing or for testing is actually monitored carefully, and that appropriate responses and appropriate testing facilities are then made available in a way that makes sense to those different communities.
Thanks for that response. So as a follow-up, Mayor Tory, a question on behalf of one of my colleagues. Green for Life's waste collection deal was extended until 2023 without competition. Do you support this move? And what's the point of privatization if you're not using competition to keep a handle on costs?
Well, I think a very sensible decision has been taken by our staff, who were delegated to do so with the approval of the City Council, which was to have this contract end coincident with the full implementation, where Toronto will be first in line, of the new Blue Box program. The Blue Box program, by the way, when it's fully implemented with more producer responsibility, will probably save the city about $15 million a year. But I think in light of the connection between overall waste collection and the new Blue Box program, it was deemed to be sensible by our officials, and I accept their judgment, to extend an existing contract for a couple of years so that you will have the two things happen coincidentally, rather than go through some long process at this stage for a program and a contract requirement that may change at the time of 2023 when the new Blue Box regime comes into place. So I think it was a sensible decision that was contemplated by the council, approved by the council, and carried out by our officials.
Okay, thank you. We go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davila, I was just wondering if you could just go back to the percent positivity number going up for the city. On Monday, we were told that there were a number of things that could be actually indicated by a number going up, like the fact that we might need more testing or a bigger sample. I'm just wondering if you could tell us if there's something behind this number going up that you can directly identify, and also if this is the result of numbers coming in before we entered the modified stage 2, or if these numbers are being driven up by something else that you can identify.
So thanks, Matt. And so for the last part of your question, the percent positivity figure of 4.4%, which I just mentioned today, is for the previous week. So for last week. And it is an important figure to follow. But of course, you'll remember that we provided in the context of the entire monitoring dashboard, because it is in fact just one indicator, an important one with a goal. And you'll note on the monitoring dashboard that each and every one of the categories actually has a goal that's set to it. And that helps us to inform the public, and frankly, to inform ourselves as public health practitioners as to how we're doing overall. So yes, of course, we're interested in following each and every one of those individual indicators that comprise the entire monitoring dashboard, but the most value comes from looking at the sum total of all the indicators. And unfortunately, when you look at our monitoring dashboard right now, the overall status is red. Hence, I'm asking people of Toronto to please continue on with those self-protection measures. This situation is very much within our hands. We can do this together, but we do have to commit to doing the things that we know make a difference in terms of stopping the spread of COVID-19. And they'll be familiar to you now: watching your distance, wearing your mask, washing your hands. And now at this time of year, getting your flu shot is something we can add to that list of actions.
Thank you. And for Mayor Tory, I know we did hear from Mary Ann Bedard, but I was just wondering, when it comes to the court challenge for the individuals who were hoping to stay in parks being dismissed, I've spoken with one of them. He says that he still feels safer in a park rather than in any of the additional choices that he's been offered indoors from the city. I'm just wondering what else the city can do to assure these individuals that the city is on their side and that it is providing more, and what else you really sort of see as the mission to drive that point home and provide even more for them.
Well, the only thing that I thought was unfortunate about the court case, and people should use the courts as they're put there to try and exercise their rights, was that it did take time away from an effort that is absolutely unyielding and continuing with more determination than ever to provide as many housing options in as broad a range as possible to all of the people that find themselves without housing at this moment. And that includes, in particular, people in encampments. And so that effort will continue. It would have continued. It did continue while the court case was going on. And I took note of the fact that the judge made particular reference and quoted the words of others in talking about the massive effort that has been undertaken by the city, by the staff, as mentioned by Ms. Bedard earlier on, to successfully move a lot of people out of circumstances that weren't in the best interest of their health in the shelter system, and in fact permanently house hundreds of people during the course of the pandemic to date. And so those efforts will continue. And I understand the fact that people need better housing options than to be in a park where it is not only against the law to be there, but it is also unsafe. And we will continue to try and provide as broad a range of options as possible for those people as we can, and to continue strenuous efforts to make sure we do better for those people in terms of making sure they have shelter available to them, especially as the weather changes.
Okay, thank you. Final question is to Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi, Dr. Davila. I wondered if you could clarify a bit more the percent positivity rates. You mentioned it was 4.4% today. It was 3.1% on Monday, but these figures don't reflect current testing. They reflect testing from a couple of weeks ago, is what you were saying?
Sorry, the percent positivity figure reflects last week's data.
Okay, so when you said it was 4.4% today and it was 3.1% on Monday, both go back in time, right?
Yes, they do. That's correct.
Okay, and then my second question is, you mentioned that there were 21 more people hospitalized?
That's correct, day over day.
And are you seeing any differences in who's being hospitalized? Does it remain people in those older categories, or are you starting to see more younger people being hospitalized, or is it just following the same kind of pattern that it did in the spring?
So Francine, I'm going to have to go back to my data team to give you more specific answers to that. I'm happy to do that offline.
Hey, Francine, hang on a second. Go ahead, Francine, with the last question.
That was my last question.
Oh, okay, great. Thank you very much. And thank you for joining us, everybody. We did have some technical difficulties with uploading to YouTube today, so we are working through that, and we'll have it online have this briefing online as quickly as possible. Thank you for joining us.